Welcome to this edition of Platform. I am Muhammad Kudu Abubakar. The federal government has continued to relax the total lockdown it imposed on the Federal Capital Territory, FCT, Lagos, and Ogun states to contain the coronavirus pandemic. Food markets now open from 10 a.m. to 2 p.m. every day, and the supermarkets and pharmacies now open from 10 a.m. to 4 p.m. every day, but with a proviso that they maintain a high level of hygiene. The new guidelines also ban bus services during the lockdown. It is now illegal to allow a mass gathering of more than 20 people. All these are against the rise of COVID-19 cases to 174 across Nigeria as at Wednesday, April 1st, 2020. This edition of Platform examines the federal government's strategies of containing the coronavirus and challenges. Our guest is the Minister of State for Health, Senator Olonumbe Mamora, a former Speaker, Lagos State House of Assembly, and two-term senator who represented Lagos East Senatorial District 2007 to 2015, and a medical doctor by training. Senator Olonumbe Mamora, Minister of State for Health, welcome to Platform.
Thank you very much for inviting me.
And thank you for accepting to be here, Honorable Minister. As usual, on the panelists section, we have Rabi Abdullah, NTA's Head of Health Desk.
It's a pleasure to be here.
And of course, we have our regular panelist, Ruth Aguele.
Thank you very much.
Of the NTA's Current Affairs Unit. Honorable Minister of State for Health, Senator Olonumbe Mamora, welcome once again to Platform.
Thank you.
Let us begin this conversation by taking Nigerians back to this immediate past, if we like, or let's put it, since the manifestation of the coronavirus itself. How has the federal government, what strategies did it adopt so far, and how did it begin the containment?
Right, thank you very much. You will recall that when this thing broke in China, Wuhan, we started preparing here because the way the virus was spreading then naturally gave the entire world, so to speak, cause for concern. So we in Nigeria, we started preparing. And what was that preparation? The emergency operation centers were activated, as well as the National Emergency Operation Center, which is the coordinating body at the national level, and of course, under the Ministry of Health, but as managed and directed by the Nigeria Center for Disease Control. And when the situation in China was escalating, and of course getting out of the country, then what we activated, it became inevitable for us to escalate it. That is, be on the lookout. You will recall that we started by monitoring particularly the flights coming into Nigeria, believing very strongly that if we were to have our first case, that is index case, most likely it will be through airports, that is air point of entry, if you like, as opposed to land, border, or the sea point of entry. So what did we do? We alerted the port health officials to put in place thermal scanners so that passengers coming in can be scanned in terms of their body temperature, which is one of the first things that will come up when you are infected. That is high body temperature to the level of fever, that is about 38 degrees centigrade. Fever is simply elevation of body temperature above the limit of normal. And of course, when that happens, it does not say that, yes, you have a coronavirus disease. You will recall that it was along the line that WHO sat down to now designate it as COVID-19. Hitherto, it was just known as coronavirus disease. Now, in addition to that, the port's health officials were to also do what we call visual observation. That because even not being a medical person or health official, if you see somebody that looks ill, you may be able to say, oh, this person is not looking well. So that is visual observation. In addition to checking the temperature. And of course, if temperature is high or the person looks ill, there's a holding room where that person will be further interrogated to know the travel history, to know whether that person is on medications, to know whether there are other symptoms that are not, readily obvious as at that point in time. Okay,
Honorable Minister, we had done all of that just to checkmate the importation of COVID-19 into the country. We started from where all our efforts were geared towards more of that prevention. But a lot of things had happened where, at a stage now where we have to deal with still prevention, we have to deal, step up our responses, and we're dealing with containing and just containing it and, putting a halt. We've been reporting cases, and as the days go by, we just keep, reporting cases. Where did we get it wrong? Is it about the attitude of Nigerians themselves or a lacuna that gave rise to where we are today?
Well, Rabi, I may not say that we got it wrong, but that is not to say you don't have a point in terms of attitude of our people. You recall that as part of the containment is this social distancing. And the whole essence of social distancing is to limit contact. Because we know that if there is no contact, the chances of getting the infection are limited. So that is why the issue of social distancing becomes very, very critical. Aside the other basic measures like personal hygiene, and particularly as it has to do with hand washing with soap and water on the running water, and of course the use of alcohol-based sanitizer. That's also important. Of course, the respiratory hygiene, where we ask people to cover up when you sneeze, when you cough, and if you do not have handkerchief or towel, paper towel, you cough into the bent elbow. Now, you discover that not everybody is observing all this. And don't forget our culture is such that we tend to want to bond as much as possible. Exactly. So people are still trying to have parties and all that until we are now seeing the devastating effect of this is because the countries, don't forget, we also need to take advantage of the experience of other countries that experienced these things before us. So we need to take all this on board and ensure that we do what is right and we follow the directives. We said people should not travel, particularly to the high burden countries. Some of our people still travel, and some people still came in from some of the. These are some of the. That's why I told Rabi earlier on that some kind of attitude again. That is, we must learn to listen to directives, to advisories, and the like.
But following what she said, from the start, we were just dealing with an index case. And yes. I know that there are processes before this whole spread became something we're trying to deal with now. It starts with active surveillance, then early detection, isolation, case management, then contact tracing. Would you say it was quite challenging, or it is still challenging for Nigeria because the numbers are increasing? at a time we were dealing with just an index case, and today we're counting 100.
174.
There is no doubt that it's challenging. I mean, I must admit, it's challenging. A few days ago, the DG, Director General of Center for Disease Control, did say that we had about 6,500 contacts that we were trying to trace. And you know, the whole thing is dynamic. And the more cases you detect, that is through PCR testing, and you confirm, that means that case has also had some contacts. So that is added to what you have on ground. And of course, contact tracing is not an easy thing because you need logistics in terms of transport, in terms of personnel, in terms of everything. So we are challenged. There is no doubt about that. And particularly, you know, in Lagos and Abuja that have the high numbers that we are.
What will you say to some people who are saying, as we observe the lockdown, there should be scaling up of the process of testing?
Well, you see, there is no doubt that, as she rightly mentioned, that is detection. And you cannot confirm that somebody is positive or negative without testing. But having said that, we must also take on board the realities that exist in our own country. I was listening to a program earlier today, and from WHO, and one of the top shots, they say that in all this, each country will have to be innovative, will have to be adaptive, will have to be flexible.
That takes me
in approach.
Okay, sir.
So testing is critical. But unfortunately, we are just expanding now our testing capability in terms of the PCR testing mode, which is what we adopt because it's the most reliable. There have been issues of rapid testing kits and all that all over the place. But as a policy for now, we have not adopted the rapid testing kit mode of testing because not very reliable.
So how many TCR centers do you have now in the
We have 7 right now.
Where?
We have in Lagos, the Lagos University Teaching Hospital. We have Nigerian Institute of Medical Research in Yaba. We have in Oshun, that's the African Center for Genomic Studies in Ede in Oshun State. We have in Abuja, which is National Reference Laboratory, that's domiciled at NCDC. And we have Irua Teaching Hospital in Edo. And then we have a new center just opened in UCH, Ibadan, and then the one in Abakaliki.
Sorry, sir, that takes me to the next question. If you recall, during one of the ministerial daily briefing on COVID-19, I had asked this question then. That was when we had just 5 laboratories, and I wasn't comfortable, with the spread, because I noticed that for just geographically anyway, for Lagos you had 2. One in Oshun, still southwest. You had Edo, south, and my question then, and you have one.
No, you have Lagos and Yaba.
Yes, you have you have 2. Yeah, 2 in Lagos, then 1 in Oshun, 1 in Edo, then the 5th one in the FCT. And my question then and my observation revolved around the fact that you had 5 laboratories then, which I felt were not evenly spread. I looked at the map. None, because for people in the northeast, means they have to probably fall back on the one in the FCT. You have northwest Kano with the population. I'm still saying that we've expanded now. We've added one in that's Ibadan. That's Oyo. which is still southwest, and you have one in Ebonyi, Abakaliki. What is the issue around here now? Because, you know, the infection is spreading, the virus is spreading like wildfire. What is the fate of the people from the northwest, northeast,
North Central?
and even, Abuja could say to be serving North Central. I'm still saying, what are the issues? Because I have said, don't we have facilities that could readily be converted to serve this purpose?
Rabbi, you see, your observation is right. But I can assure you that efforts are being made right now to look at those, you see, those institutions that have developed the capacity for testing. Some of them are already on ground. And you see, the PCR, what we call polymerase chain reaction, the testing mechanism. Some of the institutions around, they have this facility on ground, but they only need to configure the machine to be able to carry out this test. And of course, we will now have to get the reagent. So if and when these laboratories that also are in existence are supposed to starting from the scratch, because to really start from the scratch and build a laboratory that will have that capacity, it will cost not less than about 150 million.
But
so it's not even that cost. But we are looking at those who already have the testing capability, that capability, that only that the machine will have to be reconfigured.
So the government is not thinking of having a mobile testing, if you like, facility?
Well, not now because of what is involved. Because apart from having this capability in terms of the machine, and you also need the competence of the laboratory scientists, because they are specialized. They are not the routine kind of tests in the lab. But you need those who are qualified and experienced. You know, when we started,
so what logistics now, Honourable Minister, let's come back to this issue. What logistics is the ministry and the Center for Disease Control putting in place to make sure this issue of logistical distance that Rabi has pointed out is reduced to the barest minimum, if there are the need for tests and cases from the far northeast and the far northwest?
Yes, I was going to say that even initially, before we got to this point, no laboratory in Nigeria had that capacity initially. The first few cases that we had to test, the samples were taken to South Africa through the help of WHO and other. But the reagents, when the reagents now became available and some of the existing centers had their machines reconfigured to handle, then we started testing. And of course, there are plans in place to expand that facility, that is to test. Hitherto, and even in some of the centers up to now, the samples, they are being transported by a courier company, a specialized courier company that has the capacity to handle samples of such very, very significant,
sensitivity.
Yes, sensitivity.
But do we even have enough test kits? Because if you're thinking of expanding these laboratories, what about the test kits? If we're looking at the logistics involved,
we don't have enough, and no country, not even the United States, has enough because no country has it. That's true.
So how will it come into place if we're going to expand these laboratories?
That is why what we are doing now is what you can call targeted testing. Because you see, one of the things I can understand.
What do you mean by targeted? Targeted.
I'm going to explain that. I can understand the anxiety of people. You see a lot of people now, we take calls virtually every minute. I want to be tested. I think I have been exposed to somebody.
People are getting paranoid.
So that is it. So there is a lot of fear all over the place. Oh, I got in contact with somebody, or some. We can even understand somebody who is saying, "Oh, I was in contact with this person that has tested positive." But you have people, the slightest cough now, is associated with COVID-19. So, and this is the anxiety. So when we now say targeted testing, we are talking of people that fit into what we call the case definition. And what is the case definition? They have fever, they are coughing, they are having difficulty in breathing, and on top of it all, maybe they have come in contact with somebody that has tested positive, or they are people arriving from high burden countries. So those are the people that we will give priority to, and that's why we call it targeted testing. As opposed to people, if somebody comes in and says, oh, I think I have come in contact with somebody that has tested positive, we say, just hold on, go into self-isolation, observe yourself. If you start developing symptoms that we can now say this fitting into our case definition, then we will come for you.
But
so that's why I said, because we don't have enough capacity and testing materials to go around everybody.
But from what you're saying,
yes,
it's like the population, it's bringing the burden on it, from what you're saying. But are there other means, like collaboration with other countries? Because if we look at the multifaceted nature of the virus and the impact it's having on the economy presently, globally, everywhere, not just Nigeria, any collaboration with other nations? Because this is the time nations should come together.
Definitely. If you recall that when this thing was getting escalated, there was a meeting of ministers of health of the ECOWAS sub-region. I was the one who attended that meeting in Bamako, Mali. Thereafter, because the Honorable Minister of Health was somewhere there, thereafter there was another meeting organized by the AU, African Union, in Addis Ababa, which the Honorable Minister himself attended. So this collaboration is always there, because no person has all the answers, and because this is a novel, you recall the initial name was novel coronavirus, because it's new, and the behavior of the virus, even as so much is known now, so much is still unknown about it. Then that quickly brings me to the issue of this a mask. Some people will argue that, look, if you're not showing any symptoms, you don't have to wear a mask. But we cannot, some people are still saying that this thing could be airborne, aerosol, transmitted. So there are still arguments here and there. So the opinion is, the concern is that, look, if you feel you'll be protecting yourself and protecting other people like you, around you, then you can go ahead.
Now we're on the issue of the mask. Let me observe that your mask appears different from we, the ordinary persons on. That's number one. Number two, the Cross River State governor, Professor Ayade, is quoted to have said that in Cross River, as far as is concerned, no nose mask, no movement. Will the federal government adopt that in the areas that are now under lockdown?
Well, you see, if you listen to the presidential broadcast, which, I stand here, or I am seated here to thank Mr. President for that broadcast, which was easily one of the best in terms of the way it's structured, in terms of delivery, in terms of everything. What did Mr. President say? Mr. President said that we will approach this issue through proper guidance, through professionalism, and being systematic. And that's just the thing. You see, and I did say earlier on, we also need to take on board the realities of our own situation. If you say everybody should start wearing masks, do you have enough masks? So these are some of the things that have to be taken on board. We won't just come up with a policy which may be difficult or even impossible to carry out in our own situation. So those are some of the things that we need to take up, and that's why we talk of being guided by so many things, so many factors.
Now, will you say the WHO is being alarmist when it is quoted by saying the COVID-19 cases may hit 1 million in the next few days?
The WHO is not being alarming. Look at the rise in the figures, has been exponential.
Yeah, it is.
And that is the thing about COVID-19.
Yes.
The ease of spread. The ease of spread. And this is a virus that has no respect for anyone. Look at the high and mighty that have been infected and have tested positive. So that's just the WHO has a duty based on research, based on evidence, to put across to the people of the world that this is what we are getting. And it's now left for us to know how best to do what we think should be done in the circumstance.
Okay, that's taking a look at the peculiarity of Nigeria as a country. We all agree here that COVID-19 has really situated the level of weakness of the Nigerian health system, which had been over time, even though this administration has been making efforts to, reposition it. And that's why I want to ask you, as a practicing medical doctor, before you ventured into politics, I'm sure you must have, observed the way things had been as a practicing medical doctor, and now that you're a politician and even a public office holder as the Minister of State for Health. What are some of those weaknesses that COVID-19 had exposed where Nigeria is concerned, and what lessons are we learning from that? Because
how are you addressing them?
Yeah, because there's definitely going to be a post-coronavirus era, which we hope will come soon.
Amen to that.
Rabbi, thank you very much. Yes, there is no doubt that most of African nations or developing countries, we have challenges in terms of our health system. Generally, we have weak health systems. And one of the areas that you easily know what the health system is like regarding the strength or weakness is to look at the figures, maternal mortality, infant mortality, the primary health system, primary health care system. These are some of the areas that you will easily know. Issues of the high population vis-a-vis access to health care.
Out of pocket spending.
Pocket spending, immunization coverage, nutrition. These are some of the basic things, even water supply. Because a lot of times, some of the things happening in the health sector, they are not necessarily issues of the health sector. They are issues outside of the health sector. If you talk of water supply, for example, if you talk of nutrition. So, these are some of the indicators that tell you, no, you are not there. So, when a kind of either an epidemic or a pandemic like this now happens, it now exposes the weakness in the system. Because you are not just dealing now with that issue at hand, you are also dealing with some other issues. Which we talk of vulnerable groups and all that. So these are the situations that will tend to now define what we are into. Now, we ought to have put in place, because this is not the first epidemic that we're having, even though this is a pandemic, but we've had an epidemic of Lassa, we've had an epidemic of Ebola and all that. But how many states, for example, can boast of having a standard infectious disease hospital?
But Honorable Minister,
and even at the national level, do we have?
The FCT.
So this is an opportunity for us to say never again.
but do we wait until there's an outbreak before we look at some of these issues? Now, as a follow-up to what she asked, What about routine surveillance and medical intelligence, which is the backbone of any health sector anywhere in the world? Do we have that? Do we wait until when there's an outbreak?
No, that's exactly what we are saying. You see, we must have a holistic approach to this, and we should not wait. But the question is, what experiences or what lessons are we drawing from this, and how are we trying to rectify? And that's why I made reference to the... We had this before.
Now, all these,
but
the weaknesses you enumerated, Honorable Minister, are profound. But at the level of the Federal Executive Council, at the level of the Governors Forum, how is there any synergy, is there any collaboration to bring about real changes?
Oh, definitely.
Like Larabi is advocating.
Yes, in fact, that is part of the presidential mandate or the terms of reference of the PTF, that is Presidential Task Force on COVID-19. The need for us to collaborate, to engage the states through the governors, and of course the state as well, to engage the local government.
So what can you say of the responses so far?
Well,
we have 36 states.
Yes, so far, so fair. Some of the states, they are really pulling their weight in terms of putting in place structures to mitigate this present situation. Some of the states, but I cannot really say that all the states are doing. And of course, you will expect that again, maybe the resources available to the states will also be a factor in determining what and what. But on a general basis, we are having very good cooperation with the states in terms of response to this COVID-19.
Honorable Minister, at the rate at which the virus is spreading, it's pertinent that we have a recovery rate mechanism. And I'm asking this because there have been publications out there in terms of the number of ventilators we have for patients who are currently in the isolation centers. Some had said 16, some said 100, some... The minister had said, sometimes back, I think not less than 500 or so. Now that you are here, just to, give us the true picture of what we have as ventilators. I know they are not sufficient for now. We could still ask for more. But what's the state? What do we have? Do we have enough?
In fact, I think some media quoted the minister saying we need about 100 to 500 ventilators.
Well, you see, like you did say earlier on, that what lessons are we drawing and what efforts are we making to rectify the situation and, of course, prepare for future. Because there is no guarantee that we will not have... If you look at medical history, you will see all sorts of things that have happened. From the bubonic plague to Spanish flu to MERS to SARS, all these things have, they plagued the human race, and this will not be the last as well. Now, so we should take advantage of the experience from a particular situation and prepare for the future. I know that I cannot give you the exact figures because we are beginning to...
Donations.
Yes, we are having donations, we are having the others. But the good thing about COVID-19 is that only about 4% of patients infected will need intensive care unit, and that's where you need the ventilators.
All right.
Most people, 81% will, in fact, that again, that is the bad news. 80 to 81% of the patients of COVID-19 are such that, one, they may be totally asymptomatic, that is no symptoms at all. Or, where they have symptoms, these symptoms are mild to moderate. They can just pass for common cold, because coronavirus belongs to the same class of the virus that causes common cold. So somebody can just complain of a bit of headache, nasal stuffiness and all that, and they're feeling weak. So that is a good thing. So only a very small percentage will even need hospital care. But it's better to prepare for the worst. That is why the issue of this ventilators and all that, really.
So now
what
you
you're
don't know
saying
how
in
many we
essence is that from the patients we have more people with mild symptoms.
Oh, yes.
That's for the Nigerian situation?
Oh, yes.
Okay.
Yes.
So
because
you don't know how many ventilators we have right now?
We have, well, from my own, I don't know the figures you talked about that you had before, but from my own estimate of what I have seen, we have maybe over 100 to 200 ventilators that are available, but they are coming in. These things have been, there are donations here and there that are coming in, because these ventilators are not something that the routine patient will need. Okay. No.
So most of the patients available don't require.
Chances are that most of the ventilators that are even in existence right now have never even been used. But any good hospital, particularly at the epical level, both at the secondary and tertiary, because it's not every patient that will need a ventilator. Not every patient that will need ICU, that is intensive care unit management. No. So that is the good news.
As a member of the Presidential Task Force on COVID-19, it will be, I think, appropriate if you can address the funds that are coming in from the private sector. We understand it's well over 15 billion naira now. There is the need to assure Nigerians on how effective these funds will be utilized.
Well,
and what parameters have been put in place to ensure?
I think, to the best of my knowledge, most of those donations, they are statements of intention. Not that we can say, to the best of my own knowledge, that this money has been deposited here or there. Because the question will be into which account. And I'm not aware of any account right now.
So no money has
I know that there is a move to, if that is even the presidential mandate, that this should be channeled to the account. It takes a process to.
But the central bank authorities are quoted in the media to have said that they will render account of all monies pledged or donated or promised. So the task force has not had any contact with the CBN or what?
Well, there are various subcommittees of the task force, and the answer to this question will probably best be addressed by the chairman himself. And if some people have made their donations to the central bank for onward transmission, I know that there's supposed to be set an account is supposed to be in place. Whether that account will be domiciled in the central bank or not, I cannot tell you that at this point in time. But and I can't even tell you that this is the account number now until that is really handed over to us through the appropriate subcommittee of the PTF. But rest assured that this is a government that has zero tolerance for corruption. So we have a duty to ensure that every kobo of the money, and some of these donations are not necessarily in the cash. Yes. In fact, most will probably be in kind. But whatever that is donated, whether in cash or in kind, will have to be, there has to be accountability.
Okay,
for this.
Since the virus is already here and something we're contending with in Nigeria, what about, I want you, as a medical practitioner now, I want you to, advise people, especially people who are older. They say they're more vulnerable, especially when they have pre-existing condition. Yeah. I'm talking about managing the virus.
Yes.
If we must record cases of people being discharged, just a few numbers of discharge. We want to hear, more numbers are being discharged. What about people who are not old, the younger ones? What should they put into consideration in terms of immunity boost?
Well, you see, yes, we do say that from the research, from the experience of some of the other countries that have this, we established that those that tend to succumb, they are usually the elderly and those with pre-existing conditions either HIV, AIDS, tuberculosis, cardiac conditions, diabetes, what have you. So usually they have had, and even the cases that died here in Nigeria, they fit into those
categories.
Yes, categories. You know, people coming with somebody already with cancer, with diabetes, with they fell into those categories. But having said that, it is not an excuse for people, especially the younger ones, to now say, because the figures we are getting in the US now do not necessarily suggest that. So it's like it's cut across. So no one should have this false sense of being
immune,
protected. You know, good or not good. No. So everybody, in fact, that is why this has been described as all of society response. That is, everybody has to be alert and do the needful. But having said that, the basic things that we know, the simple things, hand washing, use of alcohol-based sanitizer, then of course keeping what we call respiratory hygiene, observing that, keeping social distance and all that. But particularly in response, don't forget, primarily, the healing process comes from within. That is based on your immunity.
Yes.
And one of the ways that your immunity becomes strong, they are also part of the basic things that good food, that is balanced diet, well, of course, having all the things, protein, carbohydrates, what have you, fruits, and all that. Then, sleep. You need to sleep well. You need, we say you need to have about 8 hours sleep for your systems to function, well. If you have stress, if you undergo stress for too long, it has a tendency to weaken your immunity. There's no doubt about that. That has been established. Then we ask you, of course, some of these even home remedies. Well, of course, citrus fruit is very rich in vitamin C, which can help the system. Well, on the other side, alternative medical practice or herbal practice, they have talked of garlic, they have talked of, I cannot, because that's not my, that's not
I was just going there.
But people have talked about these things, that they tend
you mean you have not tested that yourself?
Well, don't ask me what I do.
Let me just come in here. In as much as the WHO had issued guidelines regarding treatment, it had asked nations to be innovative, look inward. We know that when COVID-19 broke out in China, they had their treatment protocol, and we know what China stands for. China, when you at the mention of complementary medicine, integrative medicine practice, China is just the hub for that. And that's why I'm asking now. People have come up, even though we have issues of what do you call it now? Regulation.
Yeah.
So I'm asking, if we know the role this other alternative, medicine practice, play, why are we not, taking them into consideration? Are we taking them?
Rabbi, we are. I can tell you, so many people called me and are still calling, coming forward with one remedy or the other that can help. And what I do is to refer them. We have a department under the Ministry of Health that is in charge of what we call TICAM, traditional alternative medical practice. So we have a department, complementary and alternative. So I usually refer them to this to the director in charge of that, because whatever you claim still has to be reasonably evaluated.
Yes.
Before we can say yes. But whether you come up with evaluation or not, the reality of our situation is that the bulk of our people, they still patronize this traditional.
They do.
Yes. Traditional
Even
medical
without
thing.
them being infected with coronavirus, people are already taking
Are we
very
at any
sensitive
point?
medicine.
Are we at any point adopting some part of the protocols that the Chinese, if you like, adopted and made sure now Wuhan is in our history as far as COVID-19 is concerned?
Outside orthodox.
You know that it's not just, you see, there is what we also call non-pharmaceutical management. And part of the non-pharmaceutical management is this social distancing. And one of the factors for success in China is discipline. Discipline and what you can call enforced compliance. So those are very critical factors aside any other thing done in China. Discipline is very critical. People are given instructions or given advisories.
Back to your point, attitude.
Yeah.
Back to the point you made,
exactly.
attitude. Yes.
And of course, people will keep to it. And of course, where they are not keeping to it, some of these things are enforced. That's what I call enforced compliance in the overall interest of everyone.
Let's go back to the issue of orthodox medicine now. You know, following President Trump of the United States of America's comment on chloroquine as being efficacious in the treatment of COVID-19, it was something that generated a lot of, panic and what have you, such that back home in the country you saw people, rushing to procure chloroquine and invariably went into self-medication. Right now there are some that are dealing with toxicity that came, followed that in hospitals as I'm talking to you now. And what I think didn't help matters will be the fact that just a few, down that same day, few minutes or maybe like an hour after we had took the Minister of Health on the issue, and he had explained the fact that chloroquine had been phased out of the country. At that time it was used for the treatment of malaria following the development of resistance. And we had the DG NAFDAC not quite long coming on one of the television stations, saying something about the same chloroquine, and people misunderstood her and started, stocking up, the chloroquine, and of course the adverse effects that followed. Can you just let Nigerians know, what they should know about the true situation of chloroquine? Because I'm really scared about the toxicity now.
Yeah. Thank you very much. You're right. You see, there have been various documents, research materials talking about the certain protocol for the treatment. I say treatment quote and unquote, because ordinarily, I told you earlier on that it's your immune system that is the main thing in this, in what we're dealing with. And oftentimes, what you also do in addition is by way of supportive treatment. I mean, if you're having headache, you're having body aches, we give you paracetamol, which is an analgesic. There is something that will, counter pain and all that. If you're having fever, we give you, if you say paracetamol also has the function of, we call it antipyretic. That is something that lowers your high body temperature. We give you all that. But we are not treating COVID-19 with that. We're just treating symptoms of COVID-19. Now, but there are studies that have shown that chloroquine has a role in terms of affecting, it's a bit complicated, but it's affecting the cell and vis-a-vis the virus. It doesn't enable the virus to survive.
Does it weakens it or it eradicates it? That's
if it weakens it and it becomes powerless, so to speak. So it does
means it is treated.
Of course, the use of particular antibiotics too, which we know antibiotics does not work for virus. It works for bacteria, because if it is suspected or established that there is a secondary bacterial infection, just like when you have your common cold, whether you do something or you don't do something, some common cold will take its course.
Of 3 days.
And maybe more than that. But
days.
if it does not, we may start suspecting that there is a secondary bacterial infection, which could cause maybe infection of the airway, bronchitis or what have you, and all that. Then we give you antibiotics. The antibiotics you are giving is not to fight the virus causing common cold, but to fight the secondary bacterial infection that has come in.
For those who are stock up chloroquine, what will you be saying to them?
But yes, the basic thing is that don't take a drug not prescribed for you. That's the most important thing, because every drug is a potential poison. It depends on under what circumstance are you taking this drug. Is it prescribed, or is you are just working under self-medication, which could be. That's why the kind of thing you said, people are already now showing with chloroquine toxicity, because the question is, are they taking this chloroquine if they must at all, taking it under prescription?
Is there a prophylaxis for prevention or what?
For now, the literature has not told us that there is a place for prophylaxis, that is, prevention, that is taking something as a prevention against, because that is the essence of prophylaxis.
Honourable Minister, our time is almost up now. So to round off, what message do you have for Nigerians? We know that there is the daily briefing of the Presidential Task Force on COVID-19, but you are the guy now in our guest here in the studio. What is your message?
My message is simple. One, the hand washing has to continue with soap and water under running water. And where that is not available, that's the first choice. Where it is not available, we ask you to use alcohol-based sanitizer. And this is also important to say, there are a lot of fake sanitizers in the market. Yes. That is, they do not, because when we say alcohol-based, we are talking of hand sanitizer that has minimum of about 60% of alcohol. But I've seen myself some of these in that even by the time you put them on your palms, you know that no, this is not.
What of those who say you can use just soap and water? Soap and water, that has been established. In fact, that's the first choice. That where it is the first choice. If it's superior to alcohol-based sanitizer.
And should people use alcohol alone? Because I've seen someone using alcohol.
You see, we have even seen situation where some people will pour, very strong alcohol, pure alcohol.
Yes.
And the danger is, in fact,
some took methanol in Iran.
We've seen, yes, and we've seen people
we may have to
coming
stop
with burnt hands.
We may have to leave it there. Honourable Minister of State for Health, distinguished Senator Olorunimbe Mamora, has been our guest on platform. He's been addressing Nigeria's containment of the coronavirus, otherwise known as COVID-19. Senator Mamora, thank you so much for your time, and we will allow you to maybe go and join your colleagues at the daily briefing to continue the public engagement and education that is necessary for this period.
Thank you very much for inviting me, and I cannot thank you enough for the good job that NTA is doing, the largest in Africa.
Thank you, Honourable Minister. Rabi Abdullah, head of the NTA Health Desk. At some point, the language between the minister and you were really the same. Thank you. Ruth Agwele, NTA Current Affairs Unit. Thank you.
Rabi is a doctor. But don't ask me. Don't ask me.
The minister has already confirmed as a doctor. That's platform for today. Thank you so much for being there. I'm Muhammad Kudu Abubakar. Bye-bye for now.